Cupping massage is actually an ancient modality. It comes from China, Egypt, and many Middle Eastern countries, and it has been adapted for massage therapy. There are many health benefits to cupping. These are silicone cups. These are considered hard cups, and you use this gun to pull the air out of the cup. I'll demonstrate that later. Many cultures have used bamboo, shells, things like that. I'm not familiar with them, but I know that there are different things. There are also glass cups that you use for what's called fire cupping. I don't do that modality anymore because I lit someone on fire. Yeah, it happened. They still came back as a client. So I don't do that anymore. It's just their back hair. And then they have what's called wet cupping, and that is where they put the cup on, and when they remove it, they use a scalpel and they make a small hole. That's out of my scope of practice. I don't do that. And as my demo model pointed out, I might drown someone if I tried wet cupping. So you can see some marks right here. These are called petechia markings. They're not painful. They don't hurt. They go away within a day to 2 weeks, depending on your circulatory system. I personally, when I do cupping, I like to move the cups. I like to drag them because I feel like it lifts and it separates, and it really helps release the fascia, more so than if you just leave it in place. And you see this reddening right here, that's just beautiful fresh blood coming to the surface. And when it's lifting and separating the tissues, it's giving the opportunity for stagnant blood, lymph, white blood cells, which is part of lymph, and your blood. So it gives the opportunity for it to leave, and then freshly oxygenated, cleaned out blood, lymph, interstitial fluids, all of that comes into the area. It's different than traditional massage in the sense of we all have what's called a guarding response, especially if you're doing a deeper pressure massage. That I think is your autonomic nervous system that's triggered. I'm not sure, I could be wrong on that. But when that guarding response is triggered, the muscle will tighten down, and it's kind of counterproductive of what you're trying to do. So you can put a massage cup on that area and then continue to work, and it's going to lift and separate. And as fresh oxygenated blood and lymph and like interstitial fluid and stuff like that get to that area, it's going to help with that adhesion, and it's going to dissipate. And so I don't have to spend so much time working on it, because if it keeps locking down with pressure, you know, it's just counterintuitive to do it. I personally ask for cupping whenever I get a massage, and we offer it complimentary here. We don't have to charge for it. It's just one of the tools in our toolboxes that we like to use with our clients. So if you're interested in having a cupping massage, or you have more questions, let us know.